The health check is important because that people make sure that people get their right level of care and health check, especially around people with disabilities, because they get forgotten about in the system. And this is to make sure that we don't get forgotten about regarding our weight and different topics of our body, and prostate cancers are aware. Men are aware of prostate cancer and different levels of and diabetes. I want to make sure that this is put right. But people with learning difficulties are more prone to get uh, more illnesses than an able-bodied person can speak up for themselves. Where somebody with a learning disability or someone with autism or mental health are not quite open to do that. Basically, people with Down syndrome are more prone with the Crohn's in their body. Um, they 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 don't live. Sometimes they don't live past 40. People with Down syndrome, and they should be looked after more regarding their health because of the because that's the way it happened back in the time. That's the way it did happen with their heart, and I think they should be looked after better. You gotta really know how that person's feeling, because if you don't, you are stuck. Because a lot of people won't open up. The dietitian was very, very uncomfortable. The feeling of her kept saying, "You got to eat this, you got to eat this." But I felt she was very, very overpowered and pushy and uncomfortable. One day I said to my no, I said to my mum, "I can't cope with this no more." I was living at home, and I really can't. I couldn't cope with it no more. When I met this lady Rona, she was going to Slimmers World down in Sydenham, so she took me down to the one at Sydenham. But they realised I couldn't get up the stairs, so they found me one in Penge, and it was the best thing she ever did for me. I got to meet other people in the same boat, same problems. She helped me to express the problems I was having. Because when I was in the house, I was just eating because I was stressed, because I couldn't go out properly. She, she was, I felt that she was caring, if you understand what I mean. And she would help me, to eat healthy stuff, with Doctor when I was at the practice I was at before. She was so good. The way she took time to listen and 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 listen to what I wanted, and not about just assuming. She had a calm nature about her, and I had no problem with her. I felt that I could go and see her whenever I needed to, or I could phone her. The health action plan is very, very good because you're not always aware of what's going on with your body. Making sure you get the right tests, the right sort of support for things when you know. Yeah, I find they listen to more people without disabilities than they do with people with disabilities. It's to say to them, I'm the patient. Do not go to my support worker unless you need to. And I still say that. I say that to my doctors now. They came round and took my blood pressure round in the house. Done a health check in the house to save me going round into the surgery. I think a lot of them don't have a lot of understanding regarding, my cerebral palsy. The fact that I can't stand up. They just assume that I can do it the normal way. I have to try and stand up on a normal scales, and it's no. And the same for if I have to go and do a urine sample. They just give me a bottle and no. Easy Read is a picture format where people can see a picture of their doctor on that piece of paper, so they know that letter is from them or from what team. To say, like you had a hearing test or whatever test you're having, so you know what doctor you're seeing. Make sure it's got the NHS logo, and always have the phone number in large font so people can see it with a vision impairment. This needs to show me the sort of stuff they're going to be using on me before they do it. Because like when I was like me to do my blood pressure, to make sure they got the right size cufflink to use. If I did a video, I'm going to find it really, really hard to do. Because, number one, I don't know how to use that type of technology. I've never been trained to use that technology. So I'm going to be left behind. I'd need help from my support worker and help with how to go about it. All the information that I need so that I can express myself if I was to do a video link.